Good day, everyone. I am Dr. Dion Thaddeus Gawiran, an internist hematologist and a member of the Program for Healthcare Quality and Patient Safety of the University of the Philippines, Manila. Welcome to Module 3, where we will be discussing the prevention of common patient safety issues. This module is composed of three parts. First is reduction of healthcare-associated infections. Second is on improving effective communication. And finally, third is reducing medication errors and falls. Adverse events due to unsafe care likely are included as one of the 10 leading causes of death and disability in the whole world. According to the World Health Organization, each year, 134 million adverse events occur in hospitals in low and middle income countries due to unsafe care, resulting in about 2.6 million deaths. Common causes of preventable harm leading to unsafe care include healthcare-associated infections, medication and surgical errors, falls and patient mobility issues, communication breakdowns, diagnostic errors, inadequate patient monitoring, and pressure sores. These are important concerns, and thus healthcare organizations should continuously work to address these issues through quality improvement initiatives, staff training, and the implementation of evidence-based practices to enhance patient safety and prevent such errors. And this is also the reason why we chose these important topics and included these as the most common patient safety issues that we need to address. This specific session of Module 3 focuses on reducing healthcare-associated infections. At the end of this session, we should be able to identify important terms related to healthcare-associated infections or HAIs, identify the burden of the problem, identify common types of healthcare-associated infections, define the common modes of transmission of HAIs, identify strategies to prevent healthcare-associated infections, and finally, identify the importance of surveillance and monitoring. Healthcare-associated infections, also called hospital-acquired infections or HAIs, include infections that are acquired in the hospital by a patient who was admitted for a reason other than that of the infection itself. It's also defined as an infection occurring in a patient in a hospital or other healthcare facility in whom the infection was not yet present or incubating at the time of admission. It also includes infections that are acquired in the hospital but appears only after discharge, as well as occupational infections among the healthcare staff. HAIs are caused by virus bacteria, fungi, and viruses, and these may come from human or environmental sources. Human sources of infectious agents include patients themselves, other healthcare workers, and even visitors. Environmental sources include contaminated food, water, or medications such as IV fluids. Unfortunately, the overall burden is not fully known, but indeed, this might really be very high. As of present, there is very limited data in public domain, especially local data. Reports have shown, however, that there are higher rates in developing countries with prevalence as high as 15.5%, or 47.9 per 1,000 patient days. Healthcare-associated infections prolongs hospital stay, and in Europe, this results to 25 million extra days in the hospital. It is therefore something that really increases cost to patients and hospitals, and in 2004, the United States has reported an annual economic cost of HAIs of approximately 6.5 billion US dollars. HAIs also further worsens our problem of antibiotic resistance as patients will typically require longer courses of broader spectrum antibiotics. Reports state that more than 70% of HAIs are due to microorganisms that are already resistant to one or more antibiotics. Now, there are various types of hospital-acquired infections. Catheter-associated urinary tract infections are one of the most frequent types of HAIs and accounts for about 36% of cases. Surgical site infections, on the other hand, come in second. These are infections obtained during or after surgical procedures, and they account for about 20% of all hospital or healthcare associated infections. Bloodstream infections, usually associated with intravascular devices like access ports, and pneumonia, especially those associated with use of ventilator machines, account for about 11% each of HAIs. For an infection to take place, infectious microorganisms need to be transferred from a source to an entry site on a susceptible host, where they are able to multiply and either colonize or cause disease. Microorganisms can be transmitted in many different ways in healthcare settings. General transmission includes those involving abiotic environmental factors such as the wind, water, and animal vectors like mosquitoes carrying malaria and dengue and fleas carrying bubonic plague. On the other hand, human-to-human transmission can occur when the microbes present in the blood or other bodily fluids of a patient enter a healthcare worker or vice versa through contact with the mucous membrane or breaks in the skin. Direct contact also includes those like HIV, herpes viruses, and Ebola, where the pathogen survives best inside the body. Indirect contact involves those pathogens which survives harsh environments. Basically, you pick up a pathogen from the surface or air. Examples include those influenza and noroviruses, which may be carried by thermometers, medical devices, or toys which are inadequately decontaminated. So these likely are one of the most common transmission sources of healthcare-associated infections. Now, respiratory droplets carrying infectious pathogens are generated when an infected patient or a person coughs, sneezes, or talks, as well as during procedures such as suctioning and endotracheal intubation. These droplets travel directly from the respiratory tract of the infected individual to susceptible mucosal surfaces of the recipient over short distances. Now, facial masks can prevent this type of transmission. Airborne transmission, on the other hand, occurs through dissemination of either airborne droplet nuclei, which are particles arising from desiccation of suspended droplets, or small particles in the respirable size range containing infectious agents that may remain infective over time and over distance. Examples of which include your spores of your aspergillosis and our tuberculosis. These may be dispersed over long distances by air currents and may be inhaled by individuals who have not had direct contact with the source. Fecal oral transmission occurs through contaminated water or food, and examples include cholera, norovirus, and Shigella. Finally, percutaneous exposure occurs through contaminated sharps. Patients particularly vulnerable to colonization and infection include those with severe underlying medical disease, those who had just had recent surgery, or those with indwelling devices such as urinary catheters or endotracheal tubes. Evidence shows that infection rates can be reduced if healthcare workers comply with infection prevention and control guidelines and patients leave the hospital as soon as possible. Environmental cleanliness in the hospital is very essential in minimizing infections. Healthcare facilities should be visibly clean, and more intensive cleaning is important when there are reported outbreaks in which environmental sources are identified to play an important role. The choice of cleaning and disinfecting agent will depend on many factors, and each facility should have existing policies and guidelines and procedures on these issues. We should familiarize ourselves with procedures for cleaning up spills and contamination with vomit, urine, and other bodily fluids. We should also seek advice and information about the different disinfectants and their various applications and how we should be using these as professionals. Now, equipment, devices, and instruments must also be properly sterilized or disinfected, strictly following appropriate recommendations. We need to know the basic principles regarding these procedures and also how to verify whether these recommendations have been followed for items which have been used for patient care. There's also very important stress on the observance of the single-use principle. Devices labeled for single use are designed by manufacturers with the intention that they will no longer be reused. Examples of single-use materials include our single-use injection syringes, which should never be reused because the risk of infection is very high. Research from developing countries have revealed that free use of injection syringes or needles is a major source of HIV and hepatitis infection. Although we want to save, we will actually spend more if we develop infections from inadvertently reusing single-use items. Sterile single-use injection devices include your sterile hypodermic syringes, sterile hypodermic needles, auto-disable syringes for immunization purposes, syringe with a reuse prevention feature for general purpose, and syringes with needle stick prevention features or safety syringes for general purposes. Everyone in the healthcare team, whether in the hospital, clinic, or patient's home, needs to be aware of the importance of hand hygiene, and I believe that our experience with COVID has greatly emphasized its need. Hand hygiene is the single most important intervention that every healthcare worker can practice to prevent HAIs. Healthcare workers should advise patients and their families of the importance of hand hygiene and give them permission to remind the staff as well. At the same time, staff and students should not feel threatened when a patient or family member asks or reminds them about hand hygiene. The purpose of hand hygiene is to prevent colonization and infection of patients and healthcare workers, as well as contamination of the environment. Therefore, an indication for hand hygiene arises every time that there is a possibility of microorganism transfer from one skin or inanimate surface to another surface. To easily identify when hand hygiene should be performed, the World Health Organization has developed the 5 moments of hand hygiene model. These moments are before touching a patient, before a clean or aseptic procedure, after bodily fluid exposure risk, after touching a patient, and after touching patient surroundings. Now, the use of personal protective equipments or PPEs includes your gowns, gloves, aprons, eye protection, shoe covers, and face masks. The use of PPE is usually based on the assessment of the risk of the transmission of the specific microorganism from a patient to a caregiver and vice versa. Our uniform should be clean with attention to personal hygiene. Appropriate glove use is essential as even inappropriate use undermines all efforts to sustain hand hygiene. Patients are at risk of infection if gloves are not changed between tasks or patients. Take note that wearing gloves does not replace the need for hand hygiene. Healthcare professionals need to assess whether gloves are really needed in a given situation. We should also be aware of the significant problem of needle stick injuries among healthcare workers. Needle stick injuries are as prevalent as injuries from falls and exposure to hazardous substances. Many healthcare workers continue to be infected by bloodborne viruses, even though these infections can largely be prevented. The person using the sharp must be responsible for disposing of it safely. These safety measures are repeated in a checklist for standard procedures, and this checklist must be well known to all members of the healthcare team. Uh, Important parts of this checklist include keep handling of sharps to a minimum, not recapping, bending, or breaking needles after use, discarding each needle directly to a sharps container, a puncture-proof box like this, at the point of use immediately after use, not overloading a sharps bin if full, and always reporting injuries from needles in line with your local policies and guidelines. So these are some important strategies to prevent healthcare associated infections. Of course, Not These is a non-exhaustive list, and there are other ways by which we can prevent healthcare-associated infections. But these are some of the very important and those that can easily be applied in all institutions. Surveillance is the ongoing, systematic collection, analysis, interpretation, and evaluation of data closely integrated with the timely dissemination of these data to those who actually need it. Conducting high-quality surveillance is crucial to identify how big a problem is and to assess the impact of any prevention or improvement interventions. The purpose of healthcare-associated infection surveillance is to provide data on HAI occurrence for decision-making, policy, and research. It helps describe microbiological profiles of pathogen causing your HAIs, and depending on most frequent infections identified, it also provides critical information to plan and tailor our hospital infection prevention interventions. Surveillance can also be used to detect changes in the rates of HAIs over time, identify outbreaks, and also evaluate the impact of HAI prevention and control measures. With appropriate methodologies, surveillance data can also be used for benchmarking and as an indicator for quality of care and patient safety. Various institutions, such as the World Health Organization, outline specific evidence based recommendations regarding HAI surveillance and monitoring. So, for this session, we have discussed healthcare associated infections and strategies to prevent safety issues associated with HAIs. We hope that you found this module useful in your patient safety and quality improvement journey. Thank you very much.